Hare Krishna.
Hare Krishna Prabhu, this is Vinay Gochandadas.
Dharma Prabhuji. Hare Krishna. This is.
Hare Krishna, how are you?
I'm very good. Thank you, Prabhuji.
And that's a difficult situation, huh?
Yes, Prabhuji. Yeah, I'm getting a little bit difficult.
Where are we? Where are we in India?
No, I'm in Nepal, Prabhuji.
You're in Nepal.
Yeah,
Okay.
yeah.
You're in Nepal. Where in Nepal?
Kathmandu.
Kathmandu. I'm going to ask our Acharya Ratna Prabhu to join, okay?
Sure, sure.
He is an excellent physician also. And we have a really amazing team of physicians that works around the clock. I'm going to ask him if he can join.
Thank you, Prabhuji.
What is your name, Prabhu?
My name is Bal Nimai Das.
Bal Nimai Das. Okay. Are you having a cough also?
Mine is due to, if I feel cold, little bit cold, I get this dry cough. This is
a little cold in Nepal.
Yeah, it's getting cold now in the morning and evenings.
Yeah. Morning and evening it's a little cold. Okay. So please tell me. Just start from the beginning, and what I'll do is I'll just take some mental notes, and then I'll present if other doctors come on. Okay.
Okay.
Go ahead and tell me. If you hear music in the background, it's from the temple because I'm right in the conch building.
Okay. Thank you.
Okay. So tell me. So you know, like all the temples are surrounding all the mosques. Okay.
So yeah, what I mean was like father has he had fever for around 7 days, and we are trying to cure it at home only using the medication like paracetamol and using the antibiotic that was given from the pharmacist. But after 1 week, we were trying the naturopathy with medication as well. So what happened was after 1 week or 10 days, let's say 10 days actually, then he started the medication after 3-4 days. So after 10 days, he got difficulty in breathing actually. So we went to hospital after that, and the antibiotic was also not working. So then we went to the doctor and hospital, and there was some problem because there were so many patients that we had no isolation room as well. So the doctor they saw and they said that he's going to collapse because the level of oxygen that he was having was 70, which should be I think above 90, right? So then after that he was given oxygen at once in the emergency, and for 2 days we were in the emergency room only. So after that we got a bed in the isolation ward, and from there they say that we needed ventilator or BiPAP, at least. So after 2 days in the isolation, he got the BiPAP. So after using BiPAP, what happened was he was improving actually. So last 3 days ago in the evening at night, because of the difficulty using the BiPAP, he didn't use the BiPAP at night actually. So in the morning, I called the doctor, and doctor informed me that he didn't use the BiPAP. So, and in that day, he got difficulty. So in the evening, he felt so much difficulty that next morning the doctor called me and said that we need to shift him to the ventilator, sedated. So yesterday morning, he was shifted to the ventilator, and today morning, actually was supposed to get off the sedation, and in the morning to see how he responds actually. It wasn't good actually, and in the morning today what happened was he had difficulty, there was some problem actually. So he was getting very problems, like his BP was getting low, and he had problem with the kidney. Then when there was round of doctor around 12 o'clock, they managed to handle the situation. So they have given the medication for increasing the BP, and for kidneys as well. I think they had given the saline water. So he had fever in the morning today. So that's why the doctor told him that we could not भीमला माजीले फोन गरेर त हरिवर sorry
No problem. Okay, so can you do me one favor? Let's start from the beginning. Before that, how old is Dad?
He's 52 now, 52, 53. Yeah.
Just 53 years old. Okay.
Yeah.
And can you tell me any issues of diabetes, kidney disease, lung disease, anything? Very healthy.
That was not known. What happened was, I think a few years back, he had a problem with the, I think, urine, something like 3 years back. And we went to the hospital and sat one day and came back. That's all I knew. And I think he had sort of like symptoms of like high sugar few days or like no few weeks before, maybe few weeks or months before, just like no that we came to know now only, because the doctor said that like no the sugar level has been increased, like it should be around 5.6 around, and but it has increased to 9 in the initial days, and like no when he was in the before ICU. I think in the ICU, I think when he was shifted to ICU.
So his sugar increased to 9.
Yeah.
Actually took place. Hemoglobin A1C is what he's talking about. The hemoglobin A1C level has increased, is what you're saying. So tell me, so we thought that maybe he had pre-diabetes beforehand.
That we have no idea, because we hadn't checked that before earlier.
What was his blood pressure like beforehand?
Blood pressure was high in the beginning when he was in ICU, but it became low today. I don't know.
Okay. His kidneys function is what's his creatinine now?
Sorry, I didn't get you, Prabji.
Creatinine. Creatinine. Let me write it to you. It's maybe something you can ask the doctors there. What's his creatinine level? There's some other things that I would like to know. What's his D-dimer level? CRP, ESR, all these things. And you have a cough too, which makes me think, even though you said that you have this cough, it makes me think that you should be tested also for COVID.
Last time I had tested, it was negative, and yesterday, like in the ICU before going to ventilator, I went to see him actually once.
So you had another test?
No. I just went yesterday only. So the cough was there from day before yesterday.
Okay, so you should be careful about you too. Okay.
Oh, yeah.
So sure. I want you to start taking. Let's start with you, because if you deteriorate, then Dad may not have the support that he may needs. Is Mom also coming to the hospital?
She's here only, at home only.
She's at home. Okay.
Yeah.
Okay, so just be careful. Make sure you're wearing a mask even at home. You should get tested. That's number one, because you don't want to spread it to other. You're going to the hospital, you're coming back, you're seeing Dad, you're going back, coming back. It's possible that you're getting this also. Okay?
Oh.
So I want you on vitamin C, the vitamin D, vitamin E, and I also want you to take antibiotics. Just start it. Just start it. Most likely, you're getting some of the same symptoms. Most likely. So just trust me. Especially with a cough, a dry cough, it starts like this and whatnot. Then it turns into fever and all that. So let's make sure, and then let's get tested at the same time when you can. I know you're very busy. You have a tight schedule because you have to take care of Dad. But you need to be healthy, Okay. So that's the first thing. Second thing is what I'm really concerned about is Dad's situation. Is Dad on IV steroid?
Yeah.
Good. That's one thing. Did he start on remdesivir?
That 10 dose has been, like 10 vials have been completed.
How many?
For 10 days.
Right. So how many he's already completed with remdesivir or no?
Yeah. He has finished 10 vials, I think.
He's completed 10 vials of remdesivir. Yeah. And any improvement with the remdesivir or no? He seems to be declining on it.
Yeah, it was improving actually. He is like it was doing better actually. It was doing good, but I see that doctor was saying that he didn't use the BiPAP the night 2 days before, and that was I think the cause of difficulty in breathing actually. what the doctor, supervisor doctor, was saying was like, he had like around 30 to 40 breaths in a minute actually, so that is creating like a sort of tiredness to him actually.
Okay, so you tell me, is he on his stomach or on his back?
On his back. He's on his back now.
And how is his saturation doing? And what's do we know the ventilator settings?
Saturation is above 90 now.
That's a good sign. How high is the oxygen that he's getting?
Before he was in 10 liters. Now also it should be in 10 liters now, because it's from 15 it was decreased to 10. They were planning to decrease, but he had a difficulty like then.
Couldn't take off. Have they tried plasmapheresis? I know they should start that early, but did they try that?
They did it for 2 times already.
Oh, sorry, they gave plasma, not plasmapheresis. Did they give plasma?
Okay,
sorry, they gave IV plasma. Okay, they tried that, and they gave that 2 times.
Yeah.
Okay. Do you have this? There's one doctor that's in Gujarat that talks about Ayurveda medication. Are you aware of this?
No, probably no.
So he's had patients that are on the ventilator, and he has he studied 1,500 patients in Gujarat, and he studied a cohort of 100 to 200 critically ill patients, and he's had about a 15% better outcome with his medication. He has a naturopathic medication that he has. Now I'm still waiting for the publication of his data, but he sounds like a pretty solid scientist, and I've interviewed him before. It's not evidence-based yet because I don't have the actual publication in a journal, in a peer-reviewed journal. But it may be something you want to talk to him about as far as using this medication. I know here in Mayapur we're actually using it for people, and people are saying that it has a good effect. It makes them feel better. Here, the only side effect that they found is it causes heartburn. Heartburn for patients. There's this medication that we have. I can refer you to him and see if you can get the medication immediately. I have it here in my closet, actually. It's called Ayurveda medication. We can send you, we purchased them, but I can just send it off to you immediately. But the problem is I need you to get it in Nepal. I don't know how quickly we can get it from Kolkata to Nepal or from here to Nepal. So that's one thing. And number 2 is I don't know what the efficacy of this is. And the third thing is when you try new things in hospitals, usually they don't allow unless it's under a clinical trial to do it. So doctors are a little bit concerned about trying new things that are foreign, right? Especially you're in Nepal and we're in India.
Few medications were given to him, like from our side, like Giloy from Ramdev's. That was.
So the doctor allowed Giloy?
Yeah. They allowed it. Yeah.
They allowed Giloy? Okay, and no effect with Giloy or anything like that?
I have spoken. I didn't get the proper response. I'm like I couldn't get it. Yeah, I spoke to father and he said that he was taking it, and that also I think was making a bit better.
Okay. So we've done the remdesivir. What about did you hear anything about tocilizumab?
Sorry, probably I didn't get you.
It's called tocilizumab. No, they didn't hear. You haven't heard that.
No.
Remdesivir you have. Okay. All right. So
they are giving antibiotic now.
Yeah.
And I think I just got that one only.
So the only thing that I can think of is they've done the plasma, they've done the remdesivir. The tocilizumab is also something they may want to do. We have a rheumatologist on our team she's at Henry Ford Hospital, and she's a phenomenal rheumatologist. And she really feels that patients suffer from this massive inflammatory reaction, and tocilizumab is very helpful. It's also, so it's another medication that we should also think of. What
One more,
about,
sorry,
do they do
that is,
CT of chest?
yeah, chest X-ray. He was saying that almost most of the chests are being infected actually.
Yeah, but did they check for a pulmonary embolus, something like that, that is actually affecting his chest? That's one thing that we have to worry about with our patients. Sometimes you get blood clots in the chest.
That I have no idea.
Okay, so I'll write you a list of things that I'm thinking. I'm going to make a WhatsApp group. We'll put a WhatsApp group with you on the actual group and see if we can do these things. But you just give me an update on what exactly happens here. I'm very concerned about your father also. Are you having Nrsingadev Puja done here in Mayapur for Dad?
Yeah, I think it was sent by one of the Prabhuji, and yeah, today it was done today, I think.
Good. Okay. So that's really important because once it gets to the ventilator setting, it's very difficult, as you know, with different patients that we've had. Even international patients that we've had. That ventilator is a very difficult situation. But there are some things that we can help. Also, we need to see if we can get that medication now. Do I know it's going to work or not? No. But it's just a trial medication, and if your doctors that are there are willing to try, that's something that would be nice. So he's on high dose dexamethasone steroid. Yes, you said IV steroids. He's absolutely taking. You said they've tried the plasma. They've done the remdesivir. Tocilizumab is something that I think our rheumatologist, she likes to usually give that medication, and she's found some good success in her patients with that. Antibiotics, you said he's taking. Obviously, they're going to do the vitamin C, vitamin D within reason, and then those are the other issues. Is there anything else? And then the diabetes has to be well controlled.
Blood pressure was. I spoke earlier, just earlier 1 hour ago. The supervisor doctor, he told me that he has no fever now, but he's been given saline water and medication for increasing the heartbeat. I think the blood pressure.
Okay, there's another doctor that's joining right now. I'm not sure who's joining. It's Harilila Prabhu is also joining right now. He's our director in Mayapur, and here. So I'm just wondering how we can get you some of this medication quickly, so that this can actually work. This is it's a very critical situation. I would maybe think maybe Sukiya Chitta Prabhu. He's our superintendent here. That is also somebody that we're actually concerned about. So he's our superintendent here, and he's done a phenomenal job here on the ground as far as patients are concerned. The other thing is why isn't Dad on his stomach?
He's lying back only, not on the stomach. I'm like,
Yeah, but why not? He should be on his stomach. Are they switching his position?
okay, that I think I need to ask that. That I have no idea.
Yeah. This is actually a really important thing. Usually they do a combination of 8 hours, 16 hours, 8 hours, 16 hours, where they actually turn Dad on. They'll turn Dad onto his stomach, and he'll be able to breathe better. For maybe 8 hours a day, and then put him on his back for 16, 8 hours, 16. So they should be doing prone positioning. Okay.
This was like when we were in emergency. I was doing that, and even at when he was taken to isolation, I told him to be like, if he feels difficulty in breathing, like lie down like you are paying $10, yeah, on his stomach, and he was doing good actually. Now I have no idea now how they are
Yeah,
doing.
now it's really important. They need to put him on his stomach, and because they need to be doing that for a certain amount of time, especially if his oxygen requirement is so high. That's one of the actual treatments, and we know that decreases difficulties later on from this. So.
Now, even in the ventilator, like now he's sedated. How is that possible? Probably now. Now he's sedated now, no, from yesterday's. So he's
Yeah. Yeah, even in sedation, they can put him on his stomach.
Okay. Okay, I will speak to the doctor once.
And then the other question is if his creatinine is high, he should be, if he's having kidney problems, is he on dialysis?
Oh, he should be given dialysis if there is a problem.
I don't know. That's my next question, is because I know as far as our experience with our patients are concerned, they need dialysis usually if they have if they start to go into kidney failure. If he's not having good urine output and all this, they usually need to be put in dialysis, and then it needs to happen quickly, because otherwise if there's fluid overload, and then there's difficulty of fluid that gets on the lungs in addition to the inflammation.
Okay, so the doctor told me that they have given a medicine and that has worked, I think.
Okay, so his urine output and his creatinine is going down and all that. So you need to ask about this. So I'll ask 3 things of you on the WhatsApp group. I'll put 3 major questions, and then you just answer those questions, okay? And you ask and see. Number one is on his stomach. Are they going to put him on the stomach? Number 2 is I'm going to ask you, just give me his creatinine level. And number 3 is this: did they do a CT scan of his chest just to find out if he has any clotting that's there, or is he on a blood thinner that will for him? Okay, those are the 3 questions that I have. The suggestion I have is this medication called Ayud medication. I can go and get this Ayud medication. Hold on 1 second. Let me go down.
Okay.
1 second. Let me see if it's here. Okay, this is the medication. This is the medication, and this I interviewed the actual creator. I don't know if you can see it. I interviewed the creator of this medication about 2-3 months ago regarding this, and he has some really good results. So it may be something that we want to use. Okay, so that's Dad. Now we're going to talk about you. You have to be careful, very careful, because you have to be wearing a mask, especially if you're coughing. You need to get tested. I know it's cold there in Nepal, but you should just assume that you have it, okay?
Okay, brother.
Especially if you have brothers and sisters. I'm not sure if you have brothers and sisters or older, and especially for mom's sake, you wear a mask. Do you have masks at home?
Yes, brother.
Okay.
I have a little kid as well.
What's that? You have a kid as well. So just be careful for your wife, your child, and mom. Okay. Okay. So let's do this. Unfortunately, nobody else, because it's right now it's 7 a.m. in America.
Okay.
So the doctors that are there, they'll try to join, but I think that we can. I'll post the video for them, and maybe they can watch the video, and I'll send the video off, and then you answer those questions for me, okay?
Okay.
Okay, there's 3 questions I'm sending you. Go ahead. Any questions that you have?
The question, like the ones that you have told me, you're going to write it down for me, right?
Yes, I'm going to send those immediately off to you, okay?
Thank you, bro.
Okay. All right, Haribol.
Thank you.